Taking the stage next is Dr. Marc Lockhart, who's going to speak with us about youth challenges and resilience amid COVID-19. Dr. Lockhart is currently a psychiatrist of the Inpatient Behavioral Health Unit at the Health Services Authority, Medical Director of Behavioral Health Associates, Cayman, and the Chairman of the Mental Health Commission. Dr. Lockhart.
Thank you, Ms. Lizette, and thank you, everyone. Hello, and good morning. Good morning. We're hearing a lot of statistics, a lot of challenges. A lot of them give us pause and reflection because we have a lot of challenges to deal with. This has been a very difficult year, but we're in the Cayman Islands. How many of us, So the minister, I think, asked a question earlier of how many of us would have wanted to go back into the lockdown. I would ask the question, and I support that, but I'd ask the question, how many of us right now would want to be somewhere else? Right, there are some of us, we miss family members, we have loved ones in other places, but this is a good place to be right now. The results are, or the reasons are, because of what you have all done. The turnout today shows the commitment. It shows the growth that we're seeing in our community. It shows the resilience that our young people, and many of them that are sitting here, have been demonstrating over the years. And that's why we can all sit here without masks today and we can gather in this type of community. So I give praise to the leadership of our country for what they've done, but I think most of the praise goes to all of you, the parents, the people that make up our wonderful islands and community. Okay, great. So we've been hearing what we're facing. We've seen all the stats. We know that there have been significant changes, a lot of challenges to deal with. We're going to talk a little bit about what's needed and a little bit about how we get there. I think this past year has been terribly damaging, as Michelle Williams, who's the Dean of the Harvard School of Public Health, has said in a recent seminar. And it's been damaging to our collective mental health. There's no vaccine for mental health challenges. It's important to note that while there's this damage, it's not necessarily a damage that leads to seeking help, leads to severe pathology, leads to us falling apart. But it has affected us all. It's caused many different disruptions in our lives. And I think it's very important at this point to put some clarity and definition into mental health. We talk about mental health, we talk about mental health illness, the challenges we face, but let's define mental health so we can gain some deeper insight into the impact. So mental health is not just the absence of illness, but mental health means we're able to realize, each individual is able to realize their potential, that we're able to cope with the normal stressors of daily life, that we can work productively and fruitfully, and that we can make a contribution to our community. That's the definition of mental health. Let's hang on to that definition. And when we talk about the long-lasting impact that we all fear and know that is going to happen, it's just a matter of us trying to determine the severity of this long-term impact. We look at certain points, like high school and college, for example, are crucial periods of development for nuanced communication skills for young people. That's where many young people learn about conflict resolution. We saw the slides about the stats of violence and aggression that's seen in schools. That's where you learn how to get along with others. There's a reason why those of us that were able to go to college and wanted to pick a certain roommate and so on, many colleges say no. That's given. You're assigned a roommate because that it's teaching you how to get along with new people and how to learn many vital social skills that you're not going to learn in your home protected by your parents. So as Dr. Saxena of the World Health Organization said, it's the young adults and the children who are being impacted, and the effects are going to be long-lasting. COVID is impacting older age groups more acutely with the physical aspect, but the anxiety and depression are being faced by young adults much more. And this is actually the opposite of many other crises that we've seen in the past. Why the effects are so profound in the youth is that, remember, it not just affects health as it does in the elderly or those that are older, but this COVID situation affects the developmental stages of young people. So let's just look quickly at the developmental stages between ages 12 and 18. There are two major concepts that we look for at this point: identity and independence. So between the ages of 12 and 18, young people are creating an identity. They're learning their certain values and who they are and their sense of self. They're trying to establish that identity in relation to their society, in relation to interactions with the opposite sex, ideas for the future, their possible vocations, their thoughts about the universe and their existence, whether it be spiritual, religious, and so on. And all of this is being done with them trying to establish independence. All of these things have been disrupted significantly over the past year and will continue to be disrupted. These disruptions, then going back to the definition of mental health, are not normal. These are profound disruptions, so these affect the normal stressors of daily life. Teen years, in general, are years characterized by challenge, characterized by anxiety and a certain amount of stress. And that's just been exacerbated by the COVID-19 crisis. It's important to note that while we don't have the actual numbers in cases of infections in the Cayman Islands, the secondary effects in terms of restricting the loss of independence for young people being able to go away to school, those that are not necessarily looking to go away to school but are graduating and want to look for a job or a career or a vocational outlet, also have challenges right now with employment and opportunities. The isolation and the contradiction of quote-unquote social distancing when we were in lockdown also created a certain amount of stress and disruption. That the confusion of social distancing as opposed to physical distancing, I feel, has also created some contradictions and challenges that we're still dealing with today. Access to friends have been changed. And again, although there are interactions on island, there are many of our young people that have friends overseas, that were going to school and college, university, different training type situations, and they're missing the connections that they started to establish. The amount of virtual learning that still continues now has negative consequences. It'll be interesting to know the number of college students we have right now in Cayman that are studying online. Remember, before 2020, before this pandemic, many of us were at this podium talking about the excessive amount of screen time and the potential negativity that that has on young people. Screen time is now part of the norm, not just for educational needs, but also for their social outlets at this point. A little complexity with the screen time is that we send our young people, or many of them, overseas for their training and knowledge. Most of our young people go to either the United Kingdom, the United States, or Canada for their schooling. What is the time difference? And what I mean by that is, we have numbers of students that got up this morning at 2 a.m. to log on to a computer to take a class in the UK. What is the impact on that, on their sleep cycle? What is the impact on them emotionally? How do they manage and perform with the information that they need to retain at 3 o'clock in the morning? And what's going to be the long-term impact 2 and 3 years from now when they are in their professions? We don't know fully, but we can speculate that there will be issues. Again, how severe? That's what these forums are for, and that's what we're working on. Again, the lack of physical activity has also impacted and continues to impact. And as I said, the technology reinforcement. We've been trying for years to say technology needs to have an important balance in the influences on our lives, but not to take over our lives. I think the word Zoom is now a very common word in our lexicon. Interesting thing is that I just heard this morning that there are several hundred new words added to the Webster Dictionary. You know, they do that every year, and most of them have to do with what we're going through. The most popular word used last year, pandemic. This has caused dietary changes, because when you're waking up at 2 or 3 o'clock in the morning to take a class, I don't know what kind of breakfast you're going to eat at that time. I don't know how your day is going to change in terms of having meals. A group of young people that we cannot forget are those that have health issues. What do I mean by that? Well, we talk about the priority of those that need to get the vaccine, those 60 and older, those that have comorbid medical issues, diabetes, hypertension, asthma. What about the 16-year-old that has diabetes? What about the 18-year-old that's a bit heavy, that has hypertension, that has other issues? They also have certain anxieties and fears and wonder, am I at increased risk, although I'm not being mentioned because I'm young and I'm supposed to have the resilience? Their parents worry. When can I send my 16-year-old back to the UK to take classes? They haven't gotten a vaccine, they have asthma, they are at risk, but we're not up to get the vaccine at this point. And even with the vaccine, what could potentially happen? So those with underlying health issues that are young are a group also that are quietly worrying and suffering to a certain extent. Remember that young people respond to what they see in their environment and what's around them. And I think some of the stats that Dr. Lam and Ivan just went over highlighted that. So parental stress and the parental reaction or the caregiver's reactions to what we're going through and what we're seeing has a significant impact on the young people in the home. The adjustment to quarantine. Just anecdotally, I can say that I've probably had at least 10 severe cases over the past year of young people that returned to Ireland and had challenges dealing with quarantine, being isolated, having issues with agoraphobia, panic attacks, severe anxiety, extreme nausea, inability to sleep and eat. Because just being confined after 3, 4, 5, 6, 9, 10, unto 14 days, it really impacted them. Some of them are still dealing with some of that and have even mild post-traumatic symptoms. Now, I'm not saying we wipe out the quarantine. We have to do that to survive. But I'm saying some of the measures that we have to use to survive also have side effects. What about those with previous mental health challenges? This is our 4th symposium, and we've seen stats over the years of the severity that of symptoms that young people have experienced and have been experiencing from the past. That has been exacerbated by what we're going through right now. There are a lot of young people on island that were overseas that had their therapists, that saw therapists there, that were in treatment overseas, that had support from friends and other support groups, and that's been cut off. So just as a quick aside, one of the groups that we cannot forget that the governor mentioned about frontline workers are the frontline workers that are in this room, are the therapists, are those with the Alex Panton Foundation, those with all of that work in all the providing services. We just saw Carolina spoke about what they did through the pandemic in terms of getting data and interviewing people. It takes a lot of energy, and we're really at our maximum right now in terms of what we're managing. The impact on those with learning disabilities. So we talk again about right now using online schooling, especially for the secondary and tertiary level education. But what about the young people that have severe ADHD and have difficulty focusing to begin with? How well can they focus on their classwork on a computer screen? What about those with physical disabilities that have problems with access to even manage the screen? So the impact is significant. Viktor Frankl said that an abnormal reaction to an abnormal situation is normal behavior. So what we're going to be looking for as the norm over the next 18 to 24 months or so is a lot of dysfunction. How severe that dysfunction is going to be, I don't want to be an alarmist, we will find out. We are a very resilient community. It's in our history, it's in our DNA, it's in our cultural ethos. And I have a lot of faith in our community to overcome and to fight forward. Now, we're in the midst of change. Again, as some authors have said, we're facing an unprecedented global situation with numerous idiosyncratic factors. People are being affected in many different ways. And it's not just the physical effects, but as we're addressing today, the psychological and emotional effects, but there are also social and economic problems. The Minister of Finance is here, and he's done an expert job, and I think he, more than any of us in this room, understands the economic and social challenges that we're going to be facing moving forward. And decisions are going to have to be made, sacrifices are going to have to be made. But we're learning as we go, and we're all moving in the right direction. We require patience, understanding, and I think something that I'd like to commend us again as a community is our healthy scientific appreciation. There are too many communities, too many other countries that fought science, went against what science says in terms of wearing masks, in terms of using the physical distancing, in terms of isolating when we needed to. We made the sacrifices, and we are looking right now at the positive benefits. If we're able to do that, we are also able to address the mental health challenges that we have in our community, and we will overcome. Now, what we need to focus on, or how we intervene, is to go back in time a little bit to some of the positive tenets of positive psychology. Two major concepts I want to focus on quickly. Grit. Grit is our passion and perseverance towards reaching a long-term goal, staying on track no matter what. No matter what the criticisms are, Minister. No matter what the blogs may say. Truth draws strength from itself, not the number of votes in its favor. Keep on our path. That's what we want to teach our young people. Resilience. That's the optimism to keep bouncing back from failure. Focusing on those two ideals helps to develop independence. It helps to refine our purpose and our goals. And it helps to develop what's called self-efficacy. Self-efficacy is that ability to say, I can do this. I have enough resources within me, and I know how to reach out and what I need to accomplish something. That's the young person that you're trying to help, and they say, no, Daddy, no, Mommy, leave me. I want to try. I can do it. All right, go ahead. And they may fumble around, and they get through it. That comes from grit and resilience. And these are the things I'm sure the other speakers are going to be talking about later that we need to build on. So what influences that? Well, perseverance, continuing through, just as we said earlier, repetition of positivity. So giving young people options to gain things, to grow, to accomplish things, and then giving them the opportunity to repeat that in different settings. Understanding the power of failure. Failure has power. That's how we learn. We don't walk before we crawl. We fall down, but we have to get up, brush ourselves off. And you know, these are things that we use. Those of us that are parents, we can all tell the story of our children learning to walk, falling down, and getting up, and they're crying. You say, no, that's okay, get up, brush it off, you'll be okay, keep going. We have to refine that type of concept moving forward during this time. Appreciation of relationships. We're social creatures as human beings. Relationships make a difference. Hence, you have things like the Girls and Boys Clubs. We have social groups. We have the Alex Panton Foundation that have the young people joining together. Social contact, pro-social, positive contact is extremely powerful. Mentorships, extremely powerful. These are the types of interventions that we need to continue to enhance moving forward. Accepting help. We just saw a stat where a significant portion of young people that identified mental health issues and challenges refused to get help because of stigma and other issues. Asking for help is not a sign of weakness. It's a sign of strength. Realizing our limitations is just as powerful as knowing our abilities and our potential. Understanding also that childhood adverse events or adverse childhood events play a significant part on our development. The pain and the hurt that children and young people go through, we carry it with them for life. Does it mean that they cannot become a minister of health because they've gone through childhood challenges? No, you can overcome. You can overcome. This symposium, what we're doing today, is about overcoming and understanding and developing the tools and the tactics and the ways that are going to continue to keep us as a vibrant, positive little society in this world, punching above our weight class. And I'll copy that term from His Royal Highness that was here. There are myths about resilience. Resilient people are born that way. No, resilience is something that's learned and taught, and you have to practice it. You have to keep trying. Resilient people are always extroverts. No, that's not true. Many of us are shy and quiet, and as though we may seem like we're on the stage talking and so on, we're generally reserved people. We can be introverted. and still be very resilient, very bold about what we believe in and how we move forward. You must be successful in order to become resilient. It's the other way around. Resilience does not mean you're an emotionless person. And actually, we're going to have some information later about the importance of recognizing emotion in children and how we can use that proactively. And last but not least, that you must be resilient before you take action. No, you take action and you develop that resilience. Viktor Frankl, again, a famous psychiatrist that did a lot of work. His therapy is called logotherapy. And I think he is very relevant at this point in human history in terms of some of his conclusions. Experiencing reality by interacting authentically with the environment and with others is extremely powerful. Giving something back to the world through creativity and self-expression and changing our attitude is extremely important. And you see how all of this ties back into the definition of mental health. So making a difference, having experiences, so giving our young people the option of participating in as many varied types of activities and experiences is extremely powerful. And changing our attitude when it is required. So the meaning of life is to give life meaning. Those who have a why to live, Frankl says, can bear with almost any how. And these are the types of things that we need to keep in mind right now. Life is never made unbearable by circumstances, but by only the lack of meaning and purpose. And happiness is not something that just falls into our lap. It must be pursued. We must work on it. It takes time. It takes energy, and putting all of these things together. We as human beings fear losing something much more than we do gaining something, even of equal value. And that's called loss aversion. So whatever we lose, whatever we feel that we have lost, it affects us twice as much as what we gain. So studies were done that in many different ways, and this has been replicated many, many times. This is actually an economic theory, and the gentleman that worked on this won the Nobel Peace Prize. If you go home right now and you have whatever put away, $100, let's say, and you go and you can't find it and you lost it. Even if somebody told you, don't worry, I'm going to give you another 100, right? Human nature is that we're going to dwell on where did I put that? Where was that? Where did that go? We focus on loss. Now, so framing a question, framing an intervention, especially with young people, can make a major difference on how they deal with what they have lost or feel they are losing during this time. So you frame, instead of saying, don't worry, you're going to be okay, things are going to be fine in the future, you're going to get this and that, say, you know what? You don't want to lose the quality of life you have. Focus on what they are fearing that they may lose. Ralph Dobelli, in a very interesting book that's called The Art of Thinking Clearly, and I recommend it highly, went over and looked at the sum total of numerous studies over the last 30 years and came up with 3 major points for all of us to take home, but especially for us to try to inculcate these types of focuses in our youth. Avoid negative things that you cannot grow accustomed to, such as commuting, noise, or chronic stress. Why commuting? That's an interesting little point, because just before the pandemic, we had lots of problems with traffic. How many articles, how many complaints, how much frustration did we hear every day about coming in from the eastern districts in traffic. Commuting, interestingly enough, is one of the most stress-producing events or issues in human nature. Is it because we feel that we're trapped in the car or whatever it may be, but that affects us. So certain things like that we'll never get accustomed to. So pick and choose your battles. Know what things to avoid. And this sometimes includes people. Expect only short-term happiness from material things. As nice as your car is, as big as the house is, as much as the lottery money is, bonuses and prizes, those things give us short-term happiness. Repeated studies show people win $12, $15 million lottos in the United States and they lose it after 5 or 6 years. Actually, one study showed the majority of people that win the largest number of lottery winnings lose that money after 5 years. Material things give us short-term goals. We have to find deeper things to give us that purpose to keep moving forward in life. Aim for as much free time and an autonomy as possible, since long-lasting positive effects generally come from what you do actively. Follow your passions, even if you must forfeit a portion of of your income or finances to achieve those things. We've heard these many times before, and sometimes we feel, oh yeah, these things have been scientifically proven. This is what we need to have as a mindset moving forward in terms of helping our young people. So in summary, this is a very abnormal period we're going through. It does have a pervasive impact on all of us, not just because, again, we don't have hundreds of cases of active infection or our hospital isn't full, but we're part of the world. We're shut off right now. We can't drive to the airport right now and jump on a plane and fly. Most of us in this room have family members in other parts of the world that we're concerned about. We have young people that were away at school just very shortly or just started their education, and that's been disrupted. We have young people that were not necessarily planning to go away to school, but wanted to do a technical course or wanted to come out and graduate and start to work this year. What's happening to them? We're learning and adapting currently as we speak in terms of the information we're gathering and how to approach things. But we do have tools, focusing again on resiliency, on grit. These things can be taught, and we can set the example as the older ones in our community, as the parents, as the mentors. And some of these virtues that we talked about in terms of not focusing so much on the material, looking for deeper purpose in life, valuing everyone's role and what they contribute. These virtues are scientifically proven to help us and to help to develop that resiliency that we all need. Thank you very much.